Hey everybody, how you doing? Welcome back. It's time to revise again, and today we're going to be looking at cognitive explanations for depression. So this is Beck's Triad and it's Ellis's ABC model. Okay. Here are some exam style questions on the cognitive explanations for depression. You know the drill by now, I'm sure. Yeah, press pause to practice, give it a go, come back when you're ready for me to talk through. Right, that's your chance. Okay, let's crack on. So, identify, you don't need to explain it, a cognitive characteristic of depression. We're looking for something possibly like negative thinking, or it might be selective attention on the negative aspects of a situation. But something about thinking and how it's irrational or it's negative. Identify, again, a very kind exam question. If you get this, you're going to bank a couple of minutes here because all you need to say for the triad, the three elements are the negative thoughts about the self, negative thoughts about the world, negative thoughts about the future. Bish bash bosh. 2 marks for outlining Ellis's ABC model. Okay, so Ellis says that depression is a result of, it's not really caused by, but it's certainly linked to activating events. Okay, the events don't cause the depression, which is a common misconception. That's a bit like what we do with phobias. Yeah, that would be a behaviourist idea. So what happens is that these beliefs are kind of already pre-existing in the person. Now Beck would say that comes from childhood. But in terms of Ellis's ABC model, the beliefs are already pre-existing. And those events, for example, a job loss or a relationship breakdown, whatever it might be, activate those unhealthy beliefs. Yeah? So that's the A and the B. The activating events, they activate the negative or irrational beliefs. And that leads to the unhealthy consequence of some of the characteristics we see in depression, yeah? Things like becoming withdrawn, low mood, that sort of thing, yeah? Now we've got an application question. We've got Seb here. Relationship breakdown, doesn't want to go out, thinks no one will ever love him. And the question is, outline one cognitive explanation referring to Seb, okay? So key emphasis there on one. So if you do 2, then you're only going to get credit for 1. So don't waste your time, okay? If you picked Beck, if we pick apart 3 marks for knowledge, 3 for application, you're going to explain the triad. What you could do, because this is probably going to be a leveled question because it's, fair amount of marks, you want detail and you want accuracy and depth. So you don't want to just name these 3 parts of the triad. What you might want to include as well is Beck's other ideas about cognitive distortions or cognitive bias. So I'll give you a couple of examples. He talks about this thing called overgeneralization. Yeah, so people with depression tend to take things that have happened and apply them to things that maybe they shouldn't be applying them to. So if, for example, something bad happens, they will then think, oh, well, for all of these different events that are coming up in my life, it's all going to go badly. Yeah, they're going to generalize that to all of these different events. Yeah, overgeneralization. Often, again, according to Beck, often what we see in people with depression is magnification. So what does that sound like? It means blowing things out of proportion is possibly a way to put it. That probably sounds a little bit judgmental, but we're not trying to judge, we're trying to describe what's going on here. But they pay excessive attention, so this might even be another type of cognitive bias, excessive attention or selective attention to negative aspects of situations. And they make them bigger, potentially in their mind, than they are in reality. Yeah. So the thinking is distorted, the thinking is warped. But the key knowledge there would be that triad, okay? I would just supplement that information with the types of bias and distortion that I've mentioned. In terms of application, are we seeing elements of the triad? Yeah, of course we are. Yeah, Seb has negative thoughts about the future. Yeah, we can infer from that quote there that he thinks no one will ever love him. That's a future thing, isn't it? It's never going to get better. It's never going to be good. And he's also got negative thoughts about himself, it appears as well, yeah, a negative self-schema. Yeah, and we can infer from that second quote from him again that he isn't feeling very good about himself. Maybe he's feeling unlovable. Okay, are we seeing any types of cognitive bias or distortion? Maybe there's some overgeneralization there. Yeah, he's assuming based on that one breakdown that everybody is going to treat him that way. If you'd pick the ABC model, we've been through the knowledge for that already. So your activating event would be the relationship breakdown. The beliefs would be, he must have someone that is with him and shows him love, or else he will feel depressed or whatever it might be. So that is called masturbation or masturbatory thinking. Careful with that one. And in terms of the consequence, well, we're seeing he's become withdrawn. He's feeling low as a result of that. Okay, so that's your consequence. But as I said, just pick one. You're not going to get credit for both here. Okay, we've got a straightforward 6 marker on knowledge of both of the cognitive explanations here. Okay. And you probably just want to treat it as a 3 plus 3. That would be the simplest thing to do. So we've talked through this already, but again, the ABC model, the activating event, is activating the negative or unhealthy beliefs. That's leading to the unhealthy consequence of depression, low mood, withdrawal, that sort of thing. For Beck, talk through the triad, and I would advise you to mention 1 or 2 types of distortion, overgeneralization, magnification, that sort of thing. We're on to some evaluation now. So 3 marks, explain 1 limitation of cognitive explanations. Well, what do we think? We're looking for 3 marks for an evaluate question, probably a peel type of structure, or a point, explain, conclude, that kind of structure. What is a limitation? What should we go for? How about how it only focuses on cognitive factors? Yeah. So we understand that depression is also a result of biological factors. For example, the role of serotonin. Yeah, low serotonin levels. Yeah, is linked to low mood and depression. In fact, one of the most common ways of treating depression is actually to use SSRIs, which you'll learn about for OCD, but they target serotonin. The fact that we know these biological factors are involved means that only explaining depression in a cognitive point of view is an oversimplification. It's a partial explanation for depression. Okay? So 1 limitation, it only focuses on cognitive. Explain, actually we understand there's a role for biology. Conclude, this means it's a partial explanation for depression. It's not a full explanation. Okay. Next one, we want to discuss a strength. Okay, I want to discuss a strength. So that's presenting a strength and then giving some development, possibly a counter argument. Okay, so a strength of cognitive explanations. What would I go for? Probably the best one is applications to treatment. That's a good one. So 1 strength is their real-world application. For example, CBT is based on the ideas of Beck and Ellis. So Ellis came up with REBD, you might be aware of. Beck basically invented CBT. He's the father of CBT. And this is an effective way of helping people to deal with their depression. And you could go down the route of talking about how it can get people back into work, and therefore there's a positive economic implication in that way, if you like. Yeah. But the point is the real world application. The conclusion is that this shows that it's a useful thing to be doing in society. Yeah. The discussion could be about the economics of it, or you could counter argue with the idea of actually it doesn't help all patients. Yeah. You have to be motivated and able to reflect and express yourself and to work with a therapist in order to engage with CBT. This limits how appropriate CBT is. Yeah. So it's effective, but it's appropriate. So it's not appropriate because you have to be motivated and engaged. Now, what we don't want to do really is turn this into a discussion too much about CBT, but what we're doing here is we're discussing how useful the cognitive explanation is. So we've said it is useful because it has the applications to CBT, but that isn't the most useful application of the theory because it's not really appropriate for everyone. Yeah? So you could use that, or as an alternative counter-argument, you could say simply that it doesn't work for everyone and come back to this issue of it ignores biology. Maybe we should be looking at that as well. Yeah. Okay. So we then have an 8 marker to describe and evaluate. Again, 1 this time. Pay attention to that cognitive explanation. We've been through a lot of the material already, so it doesn't matter if you pick Beck or Ellis, but you're looking for 4 marks for knowledge, making sure to get into level 4 that you've got depth, you've got accuracy, you've got specialist terminology. Yeah. For the 4 evaluation marks, I would advise 2 kind of point, explain, conclude paragraphs, or a big chunky discussion, possibly like the one that we've just done on applications and maybe how it doesn't work, and maybe we should look at biology as well, that sort of thing. Okay. To make this up into a 16 marker, I mean, the obvious difference is the previous one was 1 explanation, so this one's 2. So you're looking at maybe do a paragraph on Beck, a paragraph on Ellis and the ABC model. And then your discussion, you're wanting probably 3 discussion points, possibly a 4th one to be safe, but you shouldn't really need to use 4. So we've talked about the fact that it ignores biology, it's only a partial explanation. We've talked about the positives in terms of the real world application and countered that, saying it doesn't work for everyone. So Again, maybe the applications are limited of this theory. You could introduce another point about research support. So there are studies that have tested people with depression on logic and reasoning tasks, and some of them have shown that people with depression do make more errors on logic tasks. Well, what does that show? It supports the fact that people with depression do have irrational thinking, which again is one of the key points of the cognitive theory. So it supports the validity and the credibility of that theory. I suppose in terms of development, you could counter-argue that with some studies that haven't shown that, or some studies that have shown or even suggested that people with depression think more rationally or more logically. Yeah, some people argue that people with depression that are quite pessimistic about the world are actually what you call a realist. Yeah, so maybe they're right. Maybe everyone else actually sees the world through rose-tinted glasses. Maybe they're the ones, the pessimists, maybe they're the ones with the right idea. And actually the world is a horrible, scary place. There's a thought for you. Didn't mean to bring you down. But that is a counter-argument, yeah? Okay. So we've covered a little bit in terms of characteristics. We've covered the triad, we've covered the ABC model, we've done a bit of application skill there, yeah, AO2. We've also been looking at some evaluation, we've done some strengths and limitations, and talked a little bit about how you might tackle an essay. Okay, so what happened when you tried it? Why did that happen? And so what? What are you going to do next? How is this going to feed back into your future revision and planning? I hope that was useful, guys. Do keep going. You got this, okay? Ask a question if you like in the comment section, and I'll try and get back to you. All right, cheers. Bish bash bosh.